For this video, I'm going to be doing my antepartal assessment. I'm also going to go ahead and include my fundal height and my Leopold maneuver in this video as well. So we're going to get right into it. Here's my patient. I'm just going to turn, actually I'm going to move my camera over here so that we can see it like this. Okay, so I would go ahead and perform my kiwis, identify myself and identify my patient. I'm gonna check my patient's bracelet, making sure I've got the right patient, and I do. This is Miss Sarah Smith, and she is 36 weeks, and she's here for just a checkup. So I'm gonna go ahead and let her know that I'm gonna be performing an antepartal assessment on her, letting her know exactly what it is that I'm gonna be doing. So I'm gonna be performing, I'm gonna be palpating her abdomen to assess the fetus to see if it's in the right position, making sure it's in the correct spot. I'm also going to be taking some vital signs. I'm going to go ahead and measure the fetus. I'm going to do an assessment of her breast and of her perineum. And we're just going to make sure she's in good condition to, of course it does, go ahead and deliver this baby. My phone's about to die. So, okay, I've identified my patient, I've performed my hand hygiene. So I'm gonna go ahead and put on my gloves. And I let Miss Smith know already that I'm gonna be performing the assessment. So I'm gonna go ahead and I'm gonna begin my assessment. I'm gonna take her vital signs to make sure she's not hypotensive or hypertensive. And I've taken her vital signs are good. I'm gonna go ahead and assess the upper part of her body, which is like her eyes, her nose, her cheeks, her mouth, because with pregnancy, those things get changed as well. So I'm going ahead and I'm assessing her eyes. I would use my pen light. Eyes are constricting, so that's good. Her nose is fine. There's no discharge from her nose, and her mouth as well. Gums are nice and pink, tongue is nice and pink. I'm gonna go ahead and palpate the lymph nodes. Lymph nodes are normal. That's good. Another thing that's super important with performing an antepartal assessment is edema. We wanna make sure the patient's not having any edema in either of the extremities, mainly the legs, which I see that she does not have any, because edema in the legs is a sign of preeclampsia, which we do not want. Okay, so once I've done that, I'm gonna go ahead and ask my patient for permission to go ahead and examine her breast, and I'm also gonna ask for permission to assess her perineum. With assessing the breast, she's given me permission to go ahead and do so. I'm just gonna palpate. This time I'd also be asking my patient if she has noticed any different masses, if she's noticed any discharge coming from her breast. Oftentimes discharge around the breast, from the breast, is pretty normal, so close to delivery, because that is the breast milk. And she states that she hasn't had any. Breast feels soft and tender, which is also normal. So moving on down, while I'm here, I'm gonna go ahead and assess her lung sounds and her heart sounds. So I would go ahead and do that, starting at the mitral. And I would just listen to her heart lung sounds. Lung sounds are normal. I can also go ahead and flip over and perform the cardiac sounds and do her cardiac sounds anteriorly and posteriorly. Okay, so now that I've done that, I'm gonna move on down to the abdomen. I'm gonna go ahead and palpate the abdomen first, making sure it's not tender. I'm also noting any moles, any skin breakdown, anything of that nature on our abdomen, and it's normal. Skin is within normal limits of the patient's skin color. I've noticed the linea nigra here, which is the line through her stomach, which is oftentimes seen in pregnancy. So that's fine. Now I'm gonna go ahead and perform the Leopold maneuver first to assess the patient's fetus. So I'm gonna go ahead and put one hand right here, right above the pelvis, and then here, just to assess, and I would do it at the same time because I wanna see if this is the fetus's head and their bottom. And I'm noticing that this side is hard and this is squishy down here where the butt is. So I know that the patient's fetus is in the correct position. I can go ahead and assess the sides to see the spine. And I know that the spine is here on the patient's left side and the arms and legs are on the right. Okay. I would also have my patient note whether she's having any contractions or any fetal movement and how often these things are happening. Because she's going to be going back home, I'm going to give her some pamphlets and things so that she can keep track of it and note if the patient, so she can be able to relate to us how much the fetus is moving and if it has not been moving as it should. So now that I know the patient's fetus is in the correct lying position, I can go ahead and do my fundal height. I didn't have like a disposable tape measure, so I just grabbed one of my dad's tape measures. I would just go ahead and measure. And this one is only in inches, so I'll say this is about 11 inches and we can translate into centimeters if need be. Okay, so now that I've done that, I'm gonna go ahead down to my patient's perineum area. She's granted me permission to go ahead and do that. I would be assessing to see if I see any warts, because warts are a sign of genital herpes, and we know that mothers cannot deliver vaginally if they have herpes because it can infect the baby. So I don't see any warts. I'm gonna ask my patient if she's been having any discharge, any bleeding, super, super important, any bleeding. She notes that she has not. Everything looks normal. It's not swollen at all. I see no redness. Okay, and there's no discharge here. And again, I'm assessing the edema in her legs, and there is not any. So that's about it for my assessment, my antepartal assessment. Thank you.